In today's new notebook, we talk with an audiologist about how hearing issues can go beyond hearing loss. Here's Angelica Carrillo.
In today's new notebook, we have Dr. Greg Swingle back with us with Arizona Hearing Specialist. Thank you so much.
Thanks for having me again.
Yes, of course. So Dr. Swingle, we're talking about Audiology Awareness Month, especially important in October.
Yeah, so Audiology Awareness Month obviously is just trying to increase the awareness of our profession. That's important because a lot of times people don't really think about their hearing until it's too late. They don't protect it necessarily from loud noise, and when they do start to notice hearing loss, they don't necessarily do anything about it. So it's important for us to kind of get the word out there and keep making sure that people are more and more aware of what we do.
A lot of times we talk about hearing loss, we talk about hearing aids, but it goes far beyond that and a little bit more about ringing in the ears.
Yeah, a lot of times that's actually one of the things that does get a patient to make an appointment. They say, you know what, I can get by with a hearing loss. I'm not sure if I have hearing loss, but I'm doing okay. But if they start to experience ringing in the ears, or what we call tinnitus or tinnitus, either one of those words are accepted. But at any rate, they do notice ringing in the ears or some sort of sound that's not in the environment, and they say, that doesn't seem right, and they make an appointment and come on in. So that's a very common type of condition that people experience. But if it gets to be louder and louder, then the patient says something must be going on here, so I want to get it checked out.
Is there a cure for it?
Unfortunately, there's not. It's a very complex kind of a thing. There's lots of causes for it, and unfortunately, once there's a trigger that causes the tinnitus, a lot of times the brain gets involved and starts to say, well, you know what, I'm just going to always assume that there's a sound there. There are ways that we can help manage it, though. We obviously want to educate the patient on what might be causing it, and we want to kind of take care of any referrals in terms of possible medical conditions that might be underlying. And then beyond that, if a person is really just distracted or bothered by their tinnitus, then there are some things that we can do, such as what we call sound therapy. I usually use the analogy of like a candle. If tinnitus is like a candle in the darkness, then that candle really stands out, and it's very, very noticeable because it's the only thing that's detectable in that darkness. So if that's the same as tinnitus, if a person says, well, I can't hear very well, they might have hearing loss, or their tinnitus is just so loud where it really stands out, then it ends up becoming like a sore thumb and they can't get past it. Sound therapy is really any process by which we end up introducing other sounds in the environment so that the tinnitus doesn't stand out as much. So it would be a similar kind of situation as if we turned on the lights in a room with that candle. I have a lot of patients who, once they start going through this process and starting to have that more enriched sound environment, they start to say, you know, I don't notice my tinnitus as much.
Dr. Greg Swingle with Arizona Hearing Specialist, thank you so much for being here.
All right, thank you.